They have some little lines here. Get close, so you know what we're doing.
No? I'll send it to you.
So we're gonna clip one right here. This is number 6. And the other one will be number 3. Small ones. Do we have more over there? Yeah, this is enough. We're gonna have one right here and one right here. Oh, never mind.
You want these two or not?
2 and 2, right?
Mm-hmm.
So look at the difference. Has to be balanced. We have 2 spaces, 2 spaces, 2 spaces, 2 spaces. If I could do this, then it's gonna be unbalanced. The machine is gonna be cracking, and you know already something is wrong. Or when you pull this, the blood. See the blood?
Yeah.
Oh.
It's clot, right?
Yeah. That's
Look at the little ones that were before,
Yeah.
because that was one of the last ones. Look at this, because this has anticoagulants, this doesn't. Remember this glue, because this glue is gonna move to the middle.
Oh,
Okay.
It's gonna melt, and it's gonna move here, and red blood cells are gonna be here, white blood cells, platelets, and plasma is gonna be here on top, the clear part. You're gonna see what's gonna happen. That's it.
This is science, guys.
Yeah. Okay, so the speed right here, it looks like 10, right? This is 1,000. This can go up to 5,000. But for the purpose of the test, we're gonna just do it 1,000. How many minutes?
10 minutes.
10. Somebody's gonna press start. See, you can barely hear it. It's not shaking. Some of the centrifuges, they just start shaking. When it starts shaking, it's because you put unlevel. It was not balanced. Or some of the tubes have more blood than the others, or one tube small and one tube is larger.
So now we wait.
Yeah, so in 10 minutes, we're gonna have the results. While we're waiting, because you're not gonna draw more blood, right? Okay. Oh, what happened to Tatiana? She disappeared? She threw herself through the window, right?
No.
She had to go.
Okay. So let's do vital signs.
Okay.
Let's do a little review, right? Because you learned already the theory, right? When we talk about vital signs, usually we put like this, VS, vital signs. So name the vital signs. How many vital signs do we have?
Blood pressure.
Okay, blood pressure, pulse,
Temperature,
temperature,
heart rate. I mean,
heart rate, pulse.
yeah, I know. Pressure, pulse, weight,
Respirations.
weight.
No, that is measurements. That's a question for your exam. These are vital signs. Vital means life. So weight and height doesn't show me that I'm alive. This has weight, everything has weight, and I can measure it, but doesn't have a life. So temperature, pulse, blood pressure, respirations. And there is another P. Anybody can know which one is this?
What's P?
Pulse,
T?
T, temperature, respirations. What is the other P? You are A in my neck.
Pain.
Have you noticed that sometimes when you go to the hospital or the clinic and you tell them that you feel some type of pain, they're gonna give you a scale 1 to 10. 1 to 10. 10 being very minimal pain, 10 being very high pain, right? So this is like kind of triage that we do in our patients. If the patient is feeling really sick, they're not gonna say 10, they said 100, they're gonna say 1,000. So you know, there's 10, right? Yeah, these are gonna be your real patients. When you go there, this is how it's gonna happen. So make sure that you don't make fun of them, you don't criticize them, you don't confront them. What do you mean? I said 1 to 10, what do you mean 100? It means that they really have a lot of pain, okay? Some others will be just acting up because they want to be seen right away, because they know that if they're going to say like 5 or 10, say, they're not going to care about me. Don't worry, it's your job to take care of them, to take all your information, and when the patient comes, when they're going to see the doctor determines what is going to be done, right? Okay, so blood pressure. This blood pressure, we're going to leave it for the last. This has to be practice. Blood pressure is one of the most difficult vital signs of all of them. I already explained you pain, right? Very easy. This is just talking to the patient. Hi, Mr. Smith. Good afternoon. My name is Roberto. I'm the medical assistant. Okay, so what is the reason that you're here today? They're going to say, oh, I have a pain in my back, pain in my stomach, pain, headache. Those are pains. So then you're going to ask them, okay, Mrs. Smith, scale 1 to 10, being 1 a very minimum pain and 10 very excruciating pain. How do you grade this pain?
6 down.
And then they're going to say, you know, whatever number. Some people are fair. They say, oh, like 6, like 7, like 8. Some of them said, oh, my goodness, it's 1,000. So, Mr. Smith, Mrs. Smith, there's no 1,000. Try again. No, you don't do that. You tell them, you just mark 10. Okay, that's the most, because remember, you're taking notes. When you taking information from your patients, when your patients comes to your office for the first time, or they are new patients, or they are patients that they've been there before. How you call a patient who's been there before? Established patients. We have new patients. This is important. And the ones that are established. Established.
I think it's E. E. Is that E? No. Oh, I saw it's a step.
So that's basically, or it is established means, so you have to learn those things. It's important that you learn those things. Whenever you deal with the patient, remember, you're going to be new. You don't know your patients. You don't know anybody in that office. So how are you going to assume whether you're new or whether you're established patient? Because you can ask, right? Excuse me, I'm here to see the doctor. That's what they're going to tell you, right? They're always going to go there. I'm going to see the doctor. Oh, sure. Are you first time here? No, I've been here before. Okay, because you're new. You are the new one. They said, no, this is my first time. Then when they tell you what is the reason, then you're going to ask, and what is the reason that you want to see the doctor? Or what brought you here today? There is different ways of asking. That's called chief complaint. So you're going to learn this. CC is chief complaint. Chief complaint. What is the chief complaint? The reason why the patient is coming to the office, to the doctor's office, to the emergency, whatever reason they have to go to see, to look for something at the medical facility. Do you have to be sick in order to go to the doctor?
No.
No. What do you go to the doctor for that you're not sick?
Checkup.
Correct. A checkup. I'm not feeling sick, but I need to do my annual checkup, this checkup. Get notes. Get something that you need, a reference from your doctor that you are fit to do something. And they're not going to evaluate you because you're not sick. You not necessarily need to be sick. You need a note for the school, for work. You were there a couple of days ago, a week ago, and then the doctor is saying, hey, you missed 1 day. Sir, remember I asked permission, you went to the doctor. Okay, I need a proof that you were at the doctor's office. You go to the doctor, and probably you are the one who's going to be giving that note to the patient. Is that understood? So this is the real world. This is how really these offices, hospitals work. So you're going to go there. Then the doctor is going to say, oh, do the vital signs. Remember, they're going to have a question in your exam. Which of the following is considered a vital sign? Is not considered a vital sign. So then, if it's not considered a vital sign, it's going to be weight, and height. These are not vital signs. So it's gonna be blood pressure, pulse, temperature, and height. So height is a measurement. I'm measuring you. Weight, I'm measuring you how much you weigh. The other one, how tall you are. That's basically what we do. So know these things because you have to record this on the patients, whether it's a manual or paper-based medical record, or enter this information in the electronic record.
Thank you.
Bless you. So that's what you have to do. So to learn those things, these are basics. And can you imagine the doctor tell you to check blood pressure or pulse, because these are the most common things that we do. This, when you do temperature,
When you have a fever.
when you complain about fever. Otherwise, we're not doing it. Well, that's the purpose.
So why they always do temperature every time you get your vitals?
Because nowadays it's because of the COVID.
Oh, okay.
They just want to make sure that you're not sick and you're not saying it.
Okay.
So that's. But before the COVID, no.
And usually they ask, have you been feeling, any fever?
Right.
Or stuff like that.
But then temperature is when you complain about fever, that you're kind of sick, or I'm coughing. Then immediately says, aha, one of the associated symptoms might be fever. Have you had any fever? Have you felt like warm? Oh yeah. Then you gotta do it because you probably say. What is another thing? What is this?
Respiration. If somebody goes in, like, they can breathe, have asthma.
Okay. So respirations. The only time that you do respirations is if my patient complain about problems breathing. I'm here because I'm checking up. I'm gonna have a checkup because I'm asthmatic. Oh no, I'm having cough. I've been coughing. So then lung problems. We're gonna see what it is. So respirations, you only take it if the patient complain about problems with respiration. And then immediately you know what is it that you gotta do. Oh, see, that thing is, right now it's,
Ready.
yeah. This is my air fryer. That's what my boss says.
Yeah.
Because he brought it to me from Queens. Okay, so look at this. Look at that. How clear that blood is.
That's water.
Oh, okay. I thought you guys fall for it. Okay. Look at this.
Wow.
This didn't melt. Why? Because we put it for very low speed. So this is like this, but it's gonna mix if. Otherwise, this, we're gonna put it for a little longer and see that this melts and goes to the middle, okay? So for now, we'll leave this right here. Let's look at this. See? This is plasma. This is suero. So it looks almost identical. So the only difference is when you evaluate the content, when you analyze them. So if I separate this and I put it in a clear bottle like that one, in a new one, how do you gonna know if this one you put it in a new one, how do you gonna know which one is plasma, which one is serum? It's very difficult to identify. You're only gonna know because you separate it from here. And as soon as I remove this from here, I'm gonna place it in another tube that is clean, empty, doesn't have no chemicals, but I'm gonna put a label there, what it is. Same with this. So let's spin it a little more because I did not like this, because I'm not gonna be able to show you exactly what I want to show you, right? So let's go up with let's put 2000 and see what happened. Oh, I don't want to hear the sounds right here. You know? Oh, hold on.
You.
See? I know it. I told you. Stop. I told you. Because this is special for plasma, not too much speed. So one of the tubes burst open. Yeah, I thought you see that I was right here, and you thought that I was
So there's blood.
all over the place.
Oh.
No, he's dramatic. I gotta see it to believe it. 1, 2, 3.
No, let me get a
He may ignore it.
shock. Look at this. Do you see it?
Really did.
Jenny was there. Oh.
Disappeared the tube. Only this. It melted. No, the tube is here.
Ay, ay, ay.
So put some gloves on, Professor.
Yeah.
That's blood.
It's like needle alligator too. So that's basically, see? That's this tube.
Oh.
See, I knew it. I know my machine because, see, that was there and I was doing like this and you were like thinking that I was just, I knew what was going to happen. It just it took a little longer than usual. Okay, so here it is, the little tube. See? Everything is there. It's just done. This popped up. So let's do this. Just leave this one only. That not gonna happen. Press start right there. Carmen. Thank you. Patricia.
Jenny from the block.
Okay, so that's not gonna pop. Those are no, I know. Okay, so we were going right here, right? So weight and height are considered measurements. So remember, you're gonna have a question in your exam that they're gonna ask you. Which of the following items is considered a vital sign? And they're gonna give you the measurements. Or which of the following is considered a measurement? And you need, or it's not. Pay attention to the questions because some of them said it's not considered a vital sign. Then immediately you look for height or weight. That's how you do it because they try to trick you sometimes. A lot of questions comes, it's not. Which one is not this? So you see all of them and then you kind of lost, right? You say, oh, wait a minute, this is right, this is right. No, it's not right because it's negating, it's saying which is not. So there is only one that do not belong to the vital signs. We will be one of these. Okay, so we did already pain, right? So you know now how to ask a patient about pain. Yes, no, maybe, probably, could be, chances are, and loss. Okay. Now let's go for pulse, because pulse is easy too. So we're gonna do pulse. I'm gonna learn how to do pulse. So where do we do pulse? In which parts of the body? We have like 12 parts of the body where we do pulse. But where do medical assistants check pulse? That's a different issue. We check it right here by the wrist, right? What side? The pinky, the middle, or the thumb? By the thumb side. So we run our fingers right here, and right here we find the radial artery, which is close to the radial bone. We have the bone right there, and it's a little group, right? It's a little space. Put your two fingers, not the thumb. Put two fingers, your index and your middle finger. Place it right there like this, and you feel your pulse immediately if you're alive.
If I'm alive.
I don't think I'm alive.
1 minute.
1 minute.
So you're gonna have your phone or your watch or your clock, whatever is available to you. Usually we have a clock right there. And then you count them like this. When you become a pro, you don't have to count it for 1 minute. You count for 30 seconds and you multiply it by 2. So I'm going for 15 seconds and multiply it by 4. But don't try to do that. For the exam, they're going to ask you, for how long are you going to be checking the pulse? 1 minute, which is equivalent to 60 seconds. It is very good to know that. Because some people, when they give you seconds, they said, oh, minutes, and they get kind of lost. I don't know why, but that happens a lot. But if you don't find there that it says 60 seconds, 1 minute is going to be the other possible answer. You're going to count it for 30 seconds, and you're going to multiply it by 2. Is that understood? Because 30 times 2, 60 seconds, which means 1 minute. Usually, that's what we do, because 1 minute is too long. When you press in on the patient's arm, so you see my pulse, you feel it right away. See? Immediately. Then we feel it. We have pulses that are irregular. Remember, we talked about EKG? Press, 2 fingers. That's it. Press like you mean it. There we go. Yours, right here. Oh no, you're dead. No, just kidding. I felt it. Right there, right? You know. But you have to press. No, because she's going like this. Listen, and well, you're not going to feel it. Then you're dead. No, you got it now, right? See, you have to press a little bit. For me, press a little bit, and you will feel it. Right there. But some people has a very faint pulse, or they have a little more skin than me. So then you have to press a little hard. It's just like when the tourniquet, you press it. If you don't see the vein, you tie it up a little more than someone who you see the blood vessels. Because you see them, you just need just a little bit. Got it?
I saw machine is going to calculate.
You're gonna count. You know, you're gonna have your watch, your phone, something, and you're gonna put it right there, and it says, okay, 30 seconds, and you do it. When you become a pro, then you do it for 15 seconds, and you multiply it by 4. And first, you have to check whether your patient has irregular or regular heartbeat. It's the same as the EKG. Remember, when it's regular, every single beat is gonna be at the same distance. When you have someone who has irregular pulse, that's why for the first time, your first patient, you do for 1 minute. So you get to know that patient. But after 30 seconds, you know already this patient, whether it's regular or not. See, when you feel my pulse, regular or irregular?
Regular, because I can feel it. It's very fast.
Do it again. What do you mean? I can feel it because it's very fast, and because you're lying, and because you're lying? Is I said lying?
I feel it.
How do you know that it's regular? Because every single beat is like at the same distance.
It is
Beats,
actually, yeah.
beats, beats, beats. That's regular. Now, what will be irregular?
If it's like
That you exactly
wait,
there you go.
beat.
You kind of press, and then you feel it, and then very fast, then disappears, and then they come back. So it's all over the place. Then immediately you know that it's irregular. For people who has irregular beat, you have to count for a period of 1 minute. There is no way to count for 30 seconds. Is that understood? You have to do it for the entire minute. This is like when we do an EKG, a patient who has an irregular heartbeat, you have to count all the QRSs and multiply it by. We have to count all the QRSs and multiply it by 10. Correct. So that's how you do it.
That's it. I would agree with.
Well, if you say that you're not agreeing with me, then you see the window?
Yeah.
Well, not me.
You
Oh, yeah.
The window?
No, I don't want you to jump. I'm going to throw you to.
Okay. We'll do that another time.
So, yes, that's how it works. See, the pulse is very easy. So try yourselves, checking yourselves the pulse. And then you're going to, not yourselves, to your classmates. Just like we did with the blood, check somebody else's pulse, check the pulse. And that's how you're gonna learn. You go home and you're gonna check the pulse. For adults, what is the normal pulse rate? 60 to 100 beats per minute. We saw that right now. See how convenient it was?
Yeah.
Because we just covered EKG. And it has to do with
And for
pulsation.
kids,
That change depends on the age. That's why they're not gonna ask you for kids.
okay.
Kids is gonna be faster. For kids, it's gonna be faster. Don't try then, because it depends on the age. It goes from 200, 180, and it's normal for them. The little that you are, the very baby that you are,
I
the
know what
faster
that
that it
like.
is. Yes, check the little babies, the newborns, and the little, just look at the nose. They flares like this. And the chest goes very fast. And sometimes you think that something is wrong with them. No, it's just that the lungs are so small that they have to breathe faster to make sure that they make up for the oxygen, the air, that they're not gonna get because they are so small. As they start growing, that's going down until it levels. When you get to the senior years, if you don't have respiratory issues, it's gonna go down again. Not up, down.
So if you got like asthma, it goes up.
No, with asthma, only when you have an asthma attack. Because then everything goes up. Your respiratory rate goes up, your pulse goes up, your blood pressure goes up, because you were kind of agitated. Is that understood? You're not behaving normally at that time. So that will be respiration. So we did pain, respirations, and pulse. You see how easy it is? Oh, and we have this now. So let's say if it worked. Otherwise, I'm gonna break the machine. I'll just do it. RPMs.
3,000 to 4,000.
What happened to two of them?
Oh, in the bathroom. One of them burst.
Yes or no?
No.
Yes.
His face.
Yes.
See now?
Okay.
So now we can see this very clear and a little more yellowish. See? And I can do this. I can do this. I can throw this right there.
Oh, it's not moving.
It's not mixing. Whereas these ones, see how long it's been? This in a spending. I'm gonna do this and what happened?
It dissolved.
It mixes it back again. Sorry. So see, this tube that has this gel on the bottom, it's kind of glue. You can spin them and you can send it to the laboratory with these ones, just like without spinning them. Did I use that marker? Yeah. Do you know that has some little things that...
Oh my god.
Okay. Stop. Okay, let's go. See. So that's how it is. Now, this is what we're gonna use to evaluate what conditions you have. Remember, this is chemistry. Here we're gonna find sodium, potassium, magnesium, chloride, cholesterol, sugar, everything that we look for, hormones, anything. Here is when we're gonna find them. Here we're not gonna find red blood cells, white blood cells, platelets. No, we're gonna find it here. So this has to be separated. From here, we use a syringe with a needle or a pipette, right? A little plastic thing that has a little ball. We pinch it, kind of suctions this, and this we transport it in an empty, clear tube. And we put the label of the patient and whatever else, and that's it. And they know that this is for serum. But this, usually we send it just like this. So we spin it, because they're not gonna mix during transportation, so we're gonna send it like this. This, we're not gonna be spinning then, because remember, as soon as we put it in a bag, and they during transportation it moves, whatever. How many times can we spin these tubes? Only once. Remember, this is for exam, and I don't want you to get this wrong at all. Now the other ones, yes.
The purple one.
Good.
Lavender.
Mhm. Any tube that doesn't have this gel on the bottom, you cannot spin it.
Okay.
Not spin it in the office. It has to be spun right there in the laboratory when they reach the laboratory. All the tubes has to be spun. Remember, this is what we're gonna use to evaluate red blood cells, white blood cells, and platelets. So the red part that is only the red blood cells,
I'm sorry, Professor. So what you call that little white part? That little.
that's the plasma.
No,
Oh, the gel.
the gel.
Mhm.
Any tube that doesn't have the gel
Uh-huh.
cannot be spin.
No, those are the ones that can be spun.
That doesn't have.
It does.
The serum doesn't spin, the plasma spins.
No, the other way around.
The
This is serum.
spins.
You can spin this, not this. Because remember,
Exactly. So that's the gel. That's the serum.
yeah, you
Gel,
need to spin
serum.
it.
Exactly. So any tube that doesn't have the gel, the serum, cannot.
Okay, no. That's false. Because this is going to go to the lab and the lab is going to spin it. You cannot spin it in your office. But they're never going to give you these questions like that.
Spin in the office. Oh, they not? Okay.
No, don't get confused. Because that means that this goes to the laboratory and the laboratory is going to evaluate this blood as it
Okay.
is.
I'm
No.
deleting that.
This is not supposed to be spent in your office.
It's only supposed to be spent in the lab.
Right, in the lab.
Okay.
These ones, you can do it because if you send it all together, this is not going to mix, see?
Okay.
So the work that you did is not a waste. This will be a waste. And not only a waste, but now this blood is not going to be good because if you spin it for the second time, this blood is going to hemolyze.
Okay.
It's going to destroy the red blood cells, white blood cells, and platelets. So then, not good. Yes?
And the gel is for separate the serum.
Right.
Serum.
This is serum separation tube.
Mm-hmm. Yeah.
That's what it's called separation because it separates the serum from the red blood cells. So that's nice, right? What about
And-
this?
Water.
Oh.
So the PRP is coming from the serum.
What is PRP?
PRP probably from the play.
What is PRP?
PRP.
Mm-hmm.
PRP.
Who teach you that?
Nobody.
Because I haven't say nothing about PRP. This is not a
So I was
plasma
lucky.
class.
So I was lucky.
No,
You have me
I.
busy thinking.
No.
There is no PRP. PRP stands for plasma platelet-rich plasma, but that's not what we're doing here. We didn't use that expression, that terms at all.
Okay.
I don't know where you're reading too much, right? But it's okay. Let's move.
I think it's a long night already.
Yeah. So now you understand why, see these tubes in your office, because most of you are going to start working in the doctor's office. If you work in a hospital, you know that hospitals are large institutions. Therefore, they have a lab within the hospital. So sometimes you don't have to spin any of them. You just put in a package with the requisition form right there on the same bag, send it to the laboratory, and that's it. They will do all these. But if you work in a doctor's office, you have to spend this because they're going to charge you for spinning this. Whereas if you do it at your office, this is less money that they're gonna charge you. So the only one that you're gonna send is this one.
Oh, sorry. Sorry. All right.
You understand?
No, but if I understood, they know, be like, oh, yeah. No,
Sorry.